media after the review meeting held today, the 7th of January 2021, Deputy Chief Minister of Meghalaya, PRESTONE TYNSONG, informed about the current COVID-19 situation in the state and also on the standard operating procedures that will be issued by the Health Department with immediate effect.
Cases today is about 64 positive cases, and of course, thank God there is no death case for today. We don't have any death case, and few issues we discussed, and very soon we are going to issue few more SOPs. I think today evening Chief Secretary will issue the SOP.
On the testing of entrance to the state of Meghalaya, PRESTONE TYNSONG said that all entry points have been strengthened so as to enable aggressive testing, which, though not mandatory, should be voluntary as a means of preventing the spread of the virus and its new variant in the entire state. At the same time, certain protocols are to be followed as advised by the Health Ministry, Government of India and the World Health Organization, added the Deputy Chief Minister.
Last time we decided that anybody coming into our state from all the entry points, irrespective of vaccinated or non-vaccinated, but they need to produce RT-PCR test within 72 hours. If it is negative, within 72 hours, they have to produce in the entry point, and then they can go to their normal duties, whatever. We also strengthen the testing of those especially who are symptomatic. We issue protocols that they need to go for testing willingly. Not necessarily that the health worker has to go and force them to go for testing, but those people who has mild symptom or who are symptomatic, the SOP says that you please go to the testing center, get yourself tested. After testing, if they are found to be positive, be it asymptomatic or be it symptomatic, for those symptomatic positive patient, it is again requested, it is again directed that they should isolate themselves in their own home quarantine. When the symptom is not that severe, stay at home for 7 days. Isolate yourself for 7 days. Then the health workers will also monitor, update their health condition. For those asymptomatic, again, though they tested positive, they need to isolate themselves again in their respective houses for 5 days. And this protocol is based on the advisories issued by the Ministry of Health and also by the advisories issued by World Health Organization.